Well, Shane, you guys deal with a lot of issues here at the Sports Medicine Department at Logan Regional Hospital. For the folks at home, kind of give us just a brief overview of what sports medicine deals with.
We're a lot more than just sports medicine. The sports medicine is, we've got a sports medicine clinic that's closely affiliated with our Acceleration Athletic Republic Clinic, where we do work a lot with the local athletes. We've got trainers at several of the high schools here in the Valley, and so we've got close ties to the high schools as well as the doctors that work with those high schools and the athletes out there. Many of the athletes that end up getting injured locally end up here, particularly where we've got trainers out there. It works very well in the fact that they know the trainers out there, they come in here for therapy, we know the trainers, they work with us, and so we kind of correlate our rehabilitation between here and the high school. A lot of the athletes can actually go back to the high schools and use their own equipment out there. So there's that, and then we also have a couple of clinics up at Utah State where we have physical therapists as well as athletic trainers and exercise physiologists that are working with our patients up there. And so we've got a lot of correlation there. The doctors also are right here in our own, right next to our own clinic here. So it makes it very, very convenient for us when we see these patients. If we've got questions for the doctors, they're just right there. Sure. The doctors spend a lot of time in our clinic coming over and seeing their patients, and so it's just some very, very strong ties. But we're a lot more than that. We do have several clinics around the Valley. We've tried to kind of create some specializations within our department. We do have the sports medicine clinic where we see most of the extremity injuries, the sports-related injuries. But then up on the second floor here in the hospital, we also have a specialty back clinic where they do all the back care, all the neck care. They also do all of our industrial medicine at this point. And we've got some very strong ties with the doctors that work in those as well. We also have other clinics, one down in Providence that's kind of more of a generalist clinic, and then a pediatrics clinic over here next to the hospital that is very, very specialized in the pediatric care.
Wow, so you guys cover a lot of ground, and it's great that it's kind of a group effort. Like you said, it's convenient for both you guys and the patient who doesn't have to keep going to someone who, really doesn't know their history or doesn't know who treated them previously. So it makes it better for both the patient and the doctor.
Yeah, exactly. We've got some really good continuity care. The doctors oftentimes will walk the patients right over and introduce them to us. We'll get them scheduled for some therapy there. At that point, we'll get going through the rehab. And as I said, we've got the acceleration department here, the athletic rehab, or the Athletic Republic clinic here that is kind of a return to sport. We'll take patients, say an ACL injury. They go through the first 3 months in physical therapy, then the next 3 months is spent here in acceleration, where basically it's taken them from that level of rehab back to sports. And then again, we've got the trainers out at the high schools that are helping with that transition all the way through it.
And it's not just university and high school athletes that you deal with, anybody in the Valley who gets injured doing something that wants to get back to doing what they love. I mean, this is the place to come. Oh,
exactly. We've got a bunch of community clinics that we've offered recently. Particularly, we've got a running clinic that we do a couple of times a year. This time of year is a very, very popular time for runners because we've got the top of Utah coming up in a couple of months. And people just don't understand that there's a lot of technique to running, and if you're not obeying Mother Nature's laws with this, you're going to end up with injuries and you're going to end up with problems. And we've had people that unfortunately they don't understand that, and they'll get right up to the marathon and they'll have to bow out because they've got some overuse injuries. We do some education with the patients or with people on correct running. We do some evaluation, we do some videotaping, break that up into, with a computer, do some slow motion analysis of them. We teach them exercises, some stretches, some other things that they may need in order to help correct their running technique. Custom shoe fits, help them find the correct shoe, and you'll be amazed how often all it is finding the correct shoe. But we can go through and evaluate that and determine what kind of shoe a patient needs. So these community clinics have been awesome. We do the running one, we do a golf one, we've been doing some with skiers, and we're also recently trying to break into some cycling type stuff to do the same thing, cycle fits and that kind of stuff.
So all sorts of clinics that people probably wouldn't even think about, that they, would go out, like you said, run a 5K or run a half marathon or a marathon, who have never really done it before, or even swinging a golf club, doing it incorrectly can just throw that back out.
Exactly. And hopefully we can prevent a lot of those injuries and at the same time improve technique and make it more enjoyable for people.
Definitely. So not only protecting them, but making them better at the sport that they love.
Yes.
Well, very cool. Well, tell people where you're located at.
We're here at Logan Regional Hospital. This is kind of the heart of it. We do have some clinics outlined, but the heart of it is here at Logan Regional Hospital, here on the first floor, right adjacent to the Canyon View Orthopedics.
Well, there you go. This is a cool gym, a cool program. And, take advantage of those clinics. You mentioned skiing, golfing, running. All throughout the year you hold these clinics. Find out when they're having the next one and make sure you're there. Shane, thanks a lot.
Thank you.